I'm a hospice nurse practitioner, and here is how I talk to my dying patients and families when they ask me, like, how much time is left. This is obviously one of the hardest questions to answer because no one has a magic 8 ball, but here is how I describe it to families and patients when they ask that question. I always kind of think of it like we have 3 stages of hospice. We've got someone that qualifies for hospice, they meet the Medicare guidelines, but they're stable. They're also well managed, right? But they qualify, so we're in that 6-month time frame, but they're stable, they're doing good. Then we have a transitioning patient. Now this is someone who is sleeping more, eating less, more confusion, falls, infections, new wounds, hallucinations, some of those different changes. Now, transitioning is a really hard phase because it can be anywhere from 2 weeks to 2 months. No one really knows for sure, but we know that we're heading in a certain direction, right? Then we have an actively dying patient, and that is someone who is comatose. We know they're not going to wake up. We know they're not going to rebound. They're not really having any oral intake. They're sleeping constantly. I mean, actively dying, right? So we're using liquid comfort medications to keep them comfortable. So that patient is anywhere from like a day up to 7 days. I mean, it still kind of depends, but it's in that range. So when someone asks me that question, I tell them, well, it's hard to know for sure. No one has a magic 8 ball, but in hospice, I think of it as this, this, and this. And I would say your loved one kind of falls into this category right now as exampled by or as evidenced by XYZ symptoms that they're having. And that has always worked really well for me. And that's a great way to think about end of life hospice patients.